am Dr. Kavita Verma, Consultant General Surgeon, and I welcome you all on behalf of Manipal Hospital, Baner. It's good to see everyone in pink in the morning on a Saturday, and welcome all gorgeous women. Now, we are talking about breast cancer. Why is so much of talk going on about breast cancer? In 1990s, in India, breast cancer was the 4th commonest cancer in India, and today it is the 1st. Globally, it has taken over lung malignancy also, and it tops the list of cancers. So it's a very, very common disease. And like she said earlier, it's denial basically. People don't want to accept that we have cancer, but it is here, and it is for us to pick it up early. The key here is picking up cancer early. Now, when we talk about breast cancer, there are stages, stage 1, 2, 3, 4, everyone knows that. Now, what is so important in this is the 5-year mortality, or the 5-year survival if you call it. Surviving breast cancer in stage 1, it is as high as 95%. So, you can aim for cure, you pick it up early. In stage 2, it goes to say 92%. But as you come lower down in stage 3, it is just 70% survival, and stage 4, it is say 20%. So the key is to pick it up early. You pick it up in the stage 1, you have good cure. Your intent is cure. So how do we pick up these cancers early? So here comes in the role of screening. When we say screening, we are trying to pick up cancers before they even manifest. One of the things is imaging, radiology, mammography, sonographies. But what every woman can do by herself is called breast self-examination. You pick up the cancers early, you consult the right doctors, the treatment can be started. So how does one do breast self-examination? What is breast self-examination? It's a very simple technique. There are 2 parts to it. One is seeing, that is looking at your breast. The second is feeling the breasts. So what do you look for and how do you do it? Now, breast self-examination is done both in lying down, that is lete karna hai, or khade hoke. You stand. What do you look for? First is looking at the breast. Now, each one is very well conversant with their own breast. So you pick up things early. You see, the nipple size, there is some change. You find some abnormal, something looks red, the skin does not look normal, some kind of protrusion, some kind of bulge. So there's something abnormal. You can pick it up better than anyone else because you know your breasts better. So any kind of look at the breast, see if there's anything abnormal. Then you feel the breasts. Now, feeling the breasts, again, it's both in lying down as well as in standing. What do? You just have to use your hands. For the left breast, use your right hand. For the right breast, you use your left hand. And you have to use not the whole hand, it's just the tips of the fingers. And start feeling the breast in circular motions. Go all around the breast. And also feel your armpit. So you have to raise your hands up when you're lying down and feel the armpit. See whether you look at anything abnormal or whether you feel anything abnormal. The best way to do a breast self-examination is actually in the shower. When your hands are wet, the breast is wet, it's very easy for you to feel the breast. And what do you feel for? Some kind of a lump. Most of the times these lumps are painless, so don't ignore anything which is not causing pain. Don't wait for the symptom to come. It may be painless. Now, painless lumps are more dangerous than the painful ones because they are more likely to be cancerous. So what do you feel for? When you, with the wet hands, you feel like, a marble slipping under the paper or some kind of an abnormal feel, something just slipping under your hand. Or you notice some kind of a discharge from the nipple. It may be very minimal. You may notice staining of your undergarments with some kind of blood or something. So anything abnormal, don't take it lightly because it's not bothering you. You need to consult. Don't go directly for examination like, don't say, I feel something, I want to go and get a mammography done. I want to get a sonography done. That's not the right way to do it. When you have anything abnormal, consult a surgeon. The surgeon will examine you and decide which is the best investigation required for you.